We have three main issues in the United States. The cost of care is too high, access to care is poor, and the quality of care is highly variable.
This year, it's going to cost $20,000 per year per family to provide health care with the employer. It's pretty simple, really. If you only offer episodes of care, you get too many episodes of care. The system is moving towards what they call value, and that's moving away from an episode of care to proactively managing a population with data.
We see about 220,000 patients annually. We have a big MSSP population, our ACO. We have about 37,000 patients that we care for. We're a track 1. We also have a lot of pay-for-performance contracts with Medicare Advantage, with commercial, and with Medicaid populations. We want to be able to send our patients to the right specialist for the right reason. We don't want it to be based on hospital affiliation or contracts that we have with hospitals.
So the 5 elements that we really need to focus on is payment change aligned with outcomes, engagement with the physicians to have them understand what they need to do, engagement with the patients to really get at supporting their transformation. We need to coordinate care, and we need to measure and report the care.
We deal a lot with data that comes from the payers, which can be very dated. Also the data that comes from the payers, sometimes it's hard to rely on. You don't know how they're crunching it and presenting it to you, and so you don't know the logic behind the data that they present. We weren't able to integrate it with our clinical data from what's really happening in the practices and with our doctors.
It's really important that we engage people. We engage doctors, we engage patients, all the stakeholders within the ecosystem of healthcare. And the best way to engage them is have them trust the data and the technology that they're using.
Innovaccer was the solution to put everything into a data lake so that we could ingest all of the claims data, all of the clinical data, and all of the other discrete data so that we could see kind of a good picture of patient 360 as to what's going on, and also outcomes trending, utilization trending, all of that for our patient population, in particular the MSSP population. With those insights that we're able to glean from Innovaccer and from all of the data aggregation, we're going to be able to tier our specialists so that our docs know who the best providers are within that specialty. So that will translate over to the patients that we care for.